Hi, everyone.
Hello from the studio audience. Welcome to another edition of Greater Living at GBMC live on Facebook. I'm Don Scott.
I'm Beth Marsden, and we are talking about a very timely subject, year-round, but specifically and particularly after one of Baltimore's infamous ice storms that we had just the other day. And I have already heard the news stories about people falling and breaking bones, and it's a huge problem. And so we're talking about orthopedics today.
Very timely.
Yeah.
And knees especially, I think.
Yeah.
So, a friend of mine is having both knees done just as soon as he recovers from bypass surgery. But
oh boy, what a great 2018
which they
for him.
caught when he was being prepped for the knee surgery.
Wow.
They caught the knee.
So Dr. Todd Melegari is here. He is a surgeon with the Department of Orthopaedics at GBMC, does a lot of sports injuries and all kinds of orthopedics. And we are going to be focusing a lot on the knees and on falling and all that kind of stuff. So let's just start there. I mean, we had all these people falling, and I know the knees really take a hit literally in an ice storm. And
elbows.
Yeah.
Wrists too.
Yeah.
Wrists too, right. So I'm just going to be, I wore a dress today for a particular reason because I have a scar from here to here, and I broke my patella. And then that is a wrist break from a year ago, so I'm a faller.
I guess you are.
As you all know, one wrong move, one split second, you're not thinking about what you're doing, and down you go. And it really has, repercussions.
Absolutely. It can affect your everyday function, the things that you take for granted, that just the simple everyday things you do. When you have an injury like that, while you're recovering and potentially even long-term, those things can be affected in ways you can't even imagine.
Yeah, Todd, I want to make sure. Can you hear Todd okay? Just should you hold the mic up a little bit?
Move the mic
there
a
you
little
go.
closer to your mouth.
We just want to hear you loud and clear.
So what is the number one orthopedic injury? Is it knees or is it hips?
It depends on, honestly, the patient population. As we age and our bone quality diminishes, that hip fractures become the most common issue. In the younger, more active population, you're definitely more likely to see a variety of different types of knee injuries.
The live TV reporter makes me ask you, I know I'm about to fall, so what do I do? Because if I go out with my hands, I'm going to break my wrist.
Well, it's probably hard to do, but if you can, probably land on your butt.
You need to fall the other way.
Yeah.
I'm a fall forwarder.
So if you ever notice, that's typically the way little kids fall when they're just learning to walk. And that's why it's a process that they very rarely get injured from. And a lot of times when you're a parent, you're watching your child learn to walk, and you're worried they're going to fall and they're going to hurt themselves. But if you watch, that's typically how they fall. They fall on their bottom and typically get back up and get back at it.
As long as your head doesn't snap back and hit the pavement.
Yes.
Yeah.
And I feel like this is like one of those kind of no-duh moments when we talk about how to avoid these injuries, but yet, as much as we know it intellectually, we tend to get busy and not pay attention, and these falls are going to happen. But clearly, we need, when there's an ice storm, if you can avoid going out, do it. And then if you have to go out, shuffle your feet, right? What are some of the other things that you tell people?
I think it's just very simple. It's just be aware of your surroundings. If you know that there's ice out there and you don't have a choice, just pay attention to where you're at. And obviously one of the most common things that people do today is they hold that phone in their hand and they're not paying attention, and that could be.
It's about
a big
being
problem.
mindful.
So yeah, that's really what it's all about.
Okay, so no one wants to hear that after the fact, So you've fallen, and the last thing you need to hear is how you could have avoided it. But let's say you have fallen, and then what should you do? How do you know if it's serious? What should you do next? Should you be icing the area? Should you immediately go to the emergency room?
I think when it comes to trying to figure out what the next best step is, it's all about pain and function. So if the pain level is such that it can be managed with simple over-the-counter medications like Tylenol or Advil, that's a good thing. If that's not the case, then you maybe need to be a little more worried. Talking about your knee, if you feel like you can't bear weight on it, you can't walk, then obviously that's a bad sign. And then, in that situation, seeking medical evaluation would be the most appropriate thing.
And who do you go to first, your internist, or do you go directly to you?
I think that honestly depends a lot on the patient. I think if you have a specific knee issue and you have a history with an orthopedist or you know somebody, I think it probably is best that you try to get in with them. Sometimes they're overwhelmed, or if you have a patient and you're a patient and you don't have any experience having any orthopedic issues, your primary care doc's generally going to be fine as well. They can at least do a little bit of an evaluation, a screening, say, is this something to be worried about or not? But like I said, I think it comes down to pain and function in terms of thinking, well, yeah, I got to go get this.
Isn't the key an X-ray?
Yeah, and then generally that's the screening test.
Right. I mean,
we see patients every day, and they come in and they have an issue, and they want to jump right to getting the MRI, and we try to explain to them, the X-ray is a cheap, easy test, and it can give us a lot of information. And 99% of the time, that's where we're going to start.
You mentioned icing. My wife and I always fight when I get injured. Where we should ice it or apply heat to it.
I think there's a lot of debate about that. My opinion is that when it's an acute injury and you're dealing with swelling, that ice is typically the best thing, because what ice does is it constricts the blood vessels, and that's how you get swelling. And so when you're talking about that situation, generally the ice is the preference. For more of the chronic aches and pains, I think you can go either way, and it just patient specific. If you've done ice and it's helped you, then that's what you keep doing. But I think for the new onset injuries, especially with the swelling, the ice is probably the way to go.
So what is that, 20 minutes on and then off? And then
typically that's exactly what I tell people. Believe it or not, if you leave it on there too long, you do run the risk of getting frostbite. It's rare, of course, but
that would add insult to injury, wouldn't it?
But 20 minutes on is usually good, and then you give it 30 to 60 minutes off, and then you can apply it again.
How often do you see people who fall and they think they have an injury, but the last thing they want to do is go into the hospital? They don't feel like getting an X-ray, and they kind of just make do for a while, and then they've exacerbated the injury, and then you look at it and you're like, oh my gosh, how have you been walking around? You have a broken this or that. Would you just say, look, just err on the side of caution and go get it?
Yeah, I think so, because if you're dealing with something as serious as a fracture, everybody's got busy lifestyles, and they've got things they got to do. They've got kids they've got to take care of. They've got to get to work, and it's very easy to put that kind of thing on the back burner. But if you were to have the misfortune of having a fracture, you could do further harm or damage. So
I would say I also fall a lot. I don't have the scars you have to show for it, but and everybody always says,
hate to brag.
Oh, just go to the doctor. He'll give you a steroid shot. And I always go, and they say that would hurt you more than what you're doing. So.
Steroid shots have a very specific role, and they can be very helpful for certain things. What steroid shots do is they get rid of inflammation. If you have an acute injury, though, something's torn or something's broken, a steroid shot's not going to do you any good. So those situations, we tend not to go down that road because they just don't really do very much.
Okay.
So other than a fracture, a break, what other kind of acute injuries are you talking about?
So I think for simplicity's sake, it's easy to break down the injuries into two main categories. The first is bone injuries, and obviously that includes fractures, and believe it or not, bone, just like your skin, can be bruised as well. The other category is soft tissue injuries. Around a joint like the knee, you're talking about mostly tendons and ligaments, as well as a structure called the meniscus. Those things you can't see on an MRI, but somebody who's trained in orthopedics generally can do an examination, get a pretty good sense of those things being injured. And injuries to those structures can range from stretching of the ligaments or to actual tearing of the ligaments. And that's where you kind of get into the subtleties.
I almost feel like the bone injury is better because from what I understand, the bone can heal to be just right.
In some cases, that's absolutely correct. Bone to bone healing generally is very reliable. Sometimes if you tear a ligament or a tendon and you want to get that structure to heal back to the bone, that can be a little more tricky. So I would agree with you.
What are the long-term after effects of having a knee replaced or something like that? Can Mary tell the weather now?
Well, it's funny.
Yes.
A lot of people after a fracture, whether or not they had surgery, do get that feeling of discomfort with changes in barometric pressure. Yeah, and I don't know that anybody knows exactly why that happens, but it definitely does happen.
Inflammation, maybe, right?
Yeah, and I think when it comes to fractures around joints, it all depends on the type of fracture. If you have a fracture that involves the surface of the joint, we call it the articular surface, and that's not back together perfectly, and you have a little bit of an incongruity there, then that can cause a wear and tear process, and ultimately then you end up with arthritis down the line. And once you get arthritis, then that causes joint pain and swelling, and a lot of times that can be managed with things like medicines or injections or physical therapy, but sometimes it gets so bad that then you take the next step, which would be replacing the joint.
So a physical injury can lead to arthritis?
Absolutely, yeah, very common.
See, I thought they were always separate.
So you were going to deal with the fall in so you would do surgery or treat someone in reaction to something that's happened, but a lot of people may be just concerned about slow deterioration over time, just wear and tear, not a particular fall, and they're starting to have an achy knee, and there's that big fear, okay, am I too young for a knee replacement? Because we hear that they only last 20 years, and you don't want to end up getting two. How can I keep my knees going for as long as possible? What's the barometer for that? At what point? I guess it's just a pain issue, right?
Yeah.
When do you get to the point where you have had enough and then you've got to face the knee replacement?
Yeah, no, I mean, you're absolutely 100% correct. It's all about the pain and the dysfunction that it causes in your everyday life. That's what the decision's all about. I mean, I can see somebody who comes into the office and has arthritis in their knee, but it doesn't really bother them too much. And then oftentimes we can minimize the symptoms associated with that arthritis with simple things. And if we can accomplish that and that patient can have a good quality of life, then they might have really bad arthritis on the x-ray, but you know what? It doesn't matter, because our goal is to make them pain-free and functional. Now, if they have arthritis and we try different things and, they can't walk down the aisle at the grocery store, they can't, walk on the sidelines of, a sporting event without having to stop because of pain, well, then that's when you say, gee, maybe it's time. And oftentimes we'll try simple things first, but if those things don't work, then kind of the last resort, last stop is the joint replacement.
I'm sometimes surprised by the age range of people who get even hip replacements too, but knee replacements. I mean, if you've been an athlete for a number of years, you could be facing a knee replacement at a fairly young age, quite possibly, right?
Sure, and it all comes down to quality of life.
Right.
I mean, there's no hard and fast rule that says, you're too young to have a joint replacement. But you had made the point earlier, and you're absolutely correct. These joint replacements are made of synthetic materials, metals and plastics and ceramics, and the reality of it is they don't last forever. And when we do a joint replacement, we like that to be a one and done. We don't like to have to come back later and do it over because it wore out. Because when you do that, the surgery is more complicated. There's a slightly higher risk of complications. So it's a tough decision to make sometimes. But again, if you're on the younger side and you've got bad arthritis and your quality of life is poor, then you might have to go in that direction.
We're going to go to a question in a minute. Sure. What's the current material they use? I know that my friends who had knee replacement 20 years ago say, well, that's much better now. They switched.
I don't know if there's honestly been any real major changes. You're basically dealing with metal and plastic we call polyethylene. And
okay.
We've done lots of research in terms of trying to get these materials to last longer, linking the polyethylene plastic, cross-linking it, we call it, has shown to be longer lasting, but at the end of the day, it's still, like I said, a synthetic material, and it is better than it used to be, but it still does have a shelf life.
Is there a partial and a full knee replacement?
Yeah, so when we talk about the knee, we generally talk about 3 different compartments, and it is possible if you have isolated arthritis in just one of those compartments that you can do a replacement where you're just putting in just replacing that specific compartment.
Okay, John wants to forward a question to you.
We have a question from an audience member. Can a previous cortisone shot mask a more serious injury from a fall 3 months later?
That's a great question. Question I get all the time. I would say in general, it's unlikely. I mean, cortisone shot, oftentimes we administer it with some anesthetic, some numbing medicine, and that can certainly cover things up, but that's very short acting. If you have a significant injury, like we said before, cortisone's not going to cover that up. It's not going to help with that. So I think if you're worried that you're still having pain after having a cortisone shot, then there's probably more going on, but it's not generally going to cover anything up.
I have a question about a lot of people are trying, I want to say homeopathic, but it's really becoming so much more mainstream now. All kinds of herbs and bone broth and something to help with collagen, and inflammation is such a hot topic right now. All these affecting the joints. What are your thoughts on taking turmeric or glucosamine or all of those kinds of things? And do you work that into your treatment before someone decides
Sure.
to get a replacement?
Yeah, I mean, in general, I think the take-home message is that none of that stuff is going to reverse a wear and tear process. But on the flip side of that, there certainly can be symptomatic relief, and generally those things are all very safe. And if somebody tries that and finds that they get relief from it, then that's great, because that's what it's all about, is trying to get that pain relief and improve that function. So yeah, I think those are reasonable options for sure.
We have a couple more questions from the audience. John?
We have a question from Howard.
Many professional athletes suffer from, I think it's a tendon or a tear of that sort in the Achilles heel, and it's a very, very difficult treatment plan. It takes a long time to recover. So my question is, for people who aren't professional sports athletes, what can you do or should you think about doing to prevent that from ever happening, especially as you get older?
So, unfortunately, oftentimes tendon ruptures are related to wear and tear of the tendon, and there's not a lot you can do to prevent wear and tear. But what you can do is maintain flexibility, and that's all about stretching and gentle strengthening exercises. So that's generally the best way. That's the best way to try to prevent that. But unfortunately, sometimes it's just something that you can't prevent.
Yeah, we talked about like avoiding the ice, but really, I mean, a lot of us do need to stretch more and really work that into as part of our natural routine, because it is all about flexibility as we get older and we start losing that, right?
Yeah, and when you have wear and tear conditions in joints, that can cause stiffness, and maintaining that flexibility can actually lessen your pain to a point. So it's helpful from a preventative standpoint, but also from a therapeutic standpoint.
Another question?
Yes.
Yeah, this question comes from Jessica. My mom fell twice within a month, broke her wrist, and then her ankle. Is it reasonable to think she may have an underlying bone density problem?
Yeah, and that's a great question as well, and I think it's very reasonable. Anytime somebody has a low energy injury, which would be a fall from a standing height, and they sustain a fracture, it's very reasonable to consider that they may have a bone density problem, and generally that's what we call osteopenia or osteoporosis. As we age, the density of our bone diminishes, and the bone becomes more susceptible to fracture. So if you're somebody that had one of these, what we call low energy injuries, and sustained a fracture, it's definitely something that you should get checked out to see. There's simple testing that you can do, and there's medication that you can take to try to reverse that process.
Does the reverse of that happen? You break a bone and then get osteoporosis because?
No, generally osteoporosis is just an age-related issue. Okay. It's not something that is from any type of traumatic injury or anything like that.
Yeah, I fell on my wrist and my mother suggested I get my bones. My mother suggested
Yeah.
I was offended.
Good advice. Yeah.
But it is good advice. And speaking of that, I mean, there's ways to help your bone density by doing strength exercises,
sure.
right? I mean, there's
bone,
another.
Yeah, bone is a dynamic tissue. It's always remodeling, and bone does respond to stress. So, honestly, the people that we worry most about in terms of osteoporosis are people that are thin, people that don't do a lot of activity, because those bones aren't seeing a lot of stress, and then they're more likely to get weak over time. So, for sure. You
mentioned that the material hasn't changed much for the knee, but do you find that the research and the experimentation is growing, or have we hit a plateau when it comes to sort of joint replacement?
There's always progress, and the reality of it is there's a lot of companies that sell these implants, and they want to make theirs the best. So it's worth it from them, from a product and design standpoint, to do research and investigation and try to get it as good as they can, because if they can beat their competitor, then they're going to be better off from a business sense in the long run. So it's ongoing, and there's always new stuff on the horizon.
Do you offer your patients upgrade so you can do this, or you can spend a little bit more money and get the Cadillac?
The $6 million man.
Honestly, when it comes to knee replacements, cost-wise, there's no major differences, and quite honestly, we don't get into that end of things as the surgeon. I mean, we generally have implant we're familiar with, and they're all generally very similar. So,
do people ask for upgrades?
I think a lot of times people more recently have heard about a lot of things by advertising. Again, it comes
on the
down,
internet,
yeah, on the internet, or even more mainstream, and companies have come up with more personalized knee replacement type where they are individualized, and I think the jury's still out in terms of them being long-term better, but people hear about it because the companies advertise it, and then they come to us and get our opinion on it.
Just finally, before we let you go, because we're running out of time, but I've often heard that orthopedic surgeon, I mean, they're in there like, and I hate to envision it because I've been a patient, but you're just in there hammering, right? I mean, it's kind of a violent kind of, you're like, is that right?
I mean,
can you describe it?
Honestly, it depends on the procedure.
But give me the worst case
scenario. For certain things, if, let's say you're one of these folks that had a knee replacement, and the knee replacement wore out, and you have to go in there and revise it, then you have to get all the old stuff out. And a lot of times that's implants that have bone grown into them, so you have to chisel around.
Chisel.
it
I mean, it's
yeah,
loud, right?
It can
and
be,
physical.
yeah. It is. It is.
Do you ask, can you feel this?
Do you have like AC/DC playing in the? You're like.
Not me personally, but I do know colleagues that do. So.
Okay. Thank you. Thank you so much, Dr. Todd Melegari. And I'm sure you're busy, so we're really happy that you took some time away to talk about what's affecting a lot of people.
It's my pleasure. I'm happy to be here.
All right, great.